results they see from all the the time and energy they put into changing their diet and removing foods and rotating foods. So I'm just going to go over kind of how I go over the test with patients, kind of give you some background, talk about how it relates to wellness and athletics and sports, and I think it's the best test there is. So if we just look at basics, the first thing that took me a while to understand was, ALCAT is not allergy testing whatsoever. The way I think about it is compatibility testing. So literally, blood is drawn, and the lab measures each patient's white blood cell response to all the different foods, food additives, food colorings, environmental chemicals, molds, pharmacoactive agents, antibiotics, and whatnot. And I think the way I kind of talk to patients about it is, we all have foods that we're compatible with and foods that we're not compatible with. And a lot of that depends on how we eat, the way we eat, the way we eat in regards to if we're rotating foods or not, the frequency we eat foods. But also I just think, just genetically, some foods we're just not supposed to eat. So traditionally, people go and they either try some sort of food elimination diet, they eliminate dairy, or they eliminate gluten, or they'll go and see the allergist and have skin testing. And, certainly allergy testing is helpful for life or death things with IgE testing and figuring out, if you have a peanut allergy and you need to avoid that to avoid anaphylaxis. But the vast, vast, vast majority of people, it's much more important to figure out what foods they're compatible with, because the vast, vast majority of people do not have some life-threatening allergy. So that's where I want to start is, the basics. It's not allergy testing. I think of it as compatibility testing, and we measure the white blood cell response. So what's the big deal with white blood cells? Well, I think it's a huge deal. I mean, I think that, inflammation is really what we're trying to reduce to prevent any sort of disease. So I think of inflammation in terms simplistically. If you sprain your ankle and you have a white blood cell aggregation, that's inflammation. If you get an insect bite, you have histamine release and white blood cells respond, that's inflammation. And that also then can lead to heart disease, diabetes, cancer, and whatnot. So inflammation is, I think, a really, really big deal. And again, the neat thing about the ALCAT test is when we measure the white blood cell response, it's outside the allergy pathways. I have so many patients who have been to the allergist and have been tested and said, oh, you're not allergic to this, you're not allergic to that, yet they know if I eat this food, I feel this way, or even more importantly, they haven't been able to connect the dots. And I think of, the symptoms that I commonly see would be, people having fatigue, headaches, kind of malaise, just kind of vague type symptoms, really can benefit from connecting the dots that the ALCAT test affords. So I really think it's much more comprehensive than traditional allergy testing. So when I think of inflammation, we've been doing all this work trying to, in the conventional world, trying to get people to exercise more, eat better, to reduce cholesterol so that we reduce their chance of having a heart attack or stroke, to reduce cancer risk. But if you look back the last 100 years, I mean, have we really made much of a dent in the rates of heart disease, cancer, diabetes, and whatnot? I don't think so. I think that the rates are about the same, if not increasing. And for me, the way I think about ALCAT playing into this is that really maybe the common denominator is food. Maybe that food is inflammatory, and the way we eat is, just as important, if not more important, than these other risk factors which are given so much credence. So I think that that's how I explain it to patients, that food is causing inflammation, and that's a really big deal. So, you can read lots of things, and we're given lots of advice by different people, nutritionists, dietitians, whatever. Different associations make recommendations saying, here are healthy foods. Broccoli is a healthy food. You should eat more broccoli. You should eat more, green vegetables, eat more red strawberries. But so certainly there's healthy foods and there's unhealthy foods. But I think the real key is that how do you really know what's the right food. And you can't really know that unless you have an ALCAT test. I mean, that's the bottom line. You can have, again, traditional allergy testing is going to tell you life or death allergy, but to really know compatibility, you need to have one of these tests. So certainly broccoli is better than cheesecake. It's healthier for you. But I would say in someone who's reacting to broccoli, that cheesecake would be a better choice. And then, there's a famous book about, and kind of the theory about eating for your blood type. And I think this is getting closer to, figuring out, okay, which foods for which people. And I think it's a good start. But ultimately, really the only way to know for each individual is to test. And so that's where ALCAT comes in and provides those answers. So how to translate the result? The way I think about it, whenever we create inflammation anywhere in the body, you're disrupting energy flow. And, all health is about energy flow, and all disease is about when that energy flow is disrupted. And there's lots of examples of that. When I think about creating inflammation, whether it's someone who, again, gets an insect bite or gets an infection, or is eating a food they shouldn't be eating, has blood sugar dysregulation, they're going to create some sort of inflammation. And when you create inflammation, you're going to create a need for cortisol release. I mean, that's one way that this energy flow gets disrupted. So when you create a need for cortisol release, you're going to be putting that energy into putting out cortisol. Another way is you're going to disrupt your mitochondrial efficiency. And our mitochondria are our cellular workhorses in every cell. And we need our mitochondria to work efficiently so that we can have energy. I mean, this goes to athletes in particular. Athletes, we know, okay, they're in good shape, they work out, they take care of themselves. Some have genetic advantages over others, but, by and large, they have efficient mitochondria. They can really turn up the energy flow. So if you have someone who's having trouble on any level, having, good amount of energy, then I think about they're having inflammation. And when they're having inflammation, again, I think number one, food. So how does this manifest clinically? Like I said before, simple things like fatigue, that's a common complaint. I see a lot of people saying they have this rash or that rash. People have headaches. People having trouble losing weight or they keep gaining weight. Joint pain is a common complaint I see about that I try to translate back to someone having inflammation. So I think of those as early manifestations. Later manifestations would be, more serious things such as hypertension, diabetes, heart disease, and cancer. And so again, the way I think about inflammation, it's a really big deal. And all we're trying to do when we tell, let me back up. When people are given statin drugs to lower cholesterol, we're just trying to reduce your risk of having a heart attack or stroke. I mean, that's the bottom line. And I think that we can do a lot better job by getting people to eat the right foods for them and make it very individualized. And I think that's what, really impresses me about the ALCAT test is, you can take someone who has all these risk factors for heart disease or stroke, they're diabetic, they have high blood pressure, they're overweight, and you can really help them cut down their risk by changing the way they eat. And I'll go into that in a little bit. So how does this work on the cellular level? Well, the way I think about it is whenever there's some sort of white blood cell increase, and again, that can be from spraining your ankle, getting an insect bite, getting an infection, or eating food you shouldn't be eating, you're going to get white blood cell aggregation. And this is going to lead to a series of cellular events. Now, some of these events are adaptive, they're helpful, and some are not. So, for example, if you sprain your ankle, at first, yeah, it's good to get that white blood cell aggregation to control the pain and take care of kind of the healing part, help heal the muscle, tendon, whatnot. Same thing with an insect bite. Same thing with an infection. You want those white blood cells there to kind of battle and take care of things. But overall, at the same time, you're pushing the cortisol button. And when you push the cortisol button, at first that's adaptive because that's going to help you take care of this inflammation. And that's a good thing. But overall, the goal is to eliminate these events. And the way I think about ALCAT playing into this is if people are eating foods they shouldn't be eating, they are having these mini events over and over every single day where they're asking their white blood cells to work harder. And again, that's disrupting their energy flow. So, okay, adaptive events. When I think of adaptive, I mean it's helpful in the short term. Cortisol release. Cortisol is your firefighter. It's your stress hormone. Excuse me. This is an adaptive event. You need cortisol response. The way I explain cortisol to patients is if you're sleeping in the middle of the night and you hear a noise and you're awake and alert, that's cortisol. That's adaptive for you. You need that response. Same thing if you get an infection. You need white blood cells there on the scene to take care of the infection. You need cortisol there to help calm down the inflammation. That's adaptive. But we want your cortisol to return back to normal. We want it to happen pretty quickly. So in the short term, this is good. But if you can imagine how if you're doing that every day, if someone is eating foods they shouldn't be eating every day, they are getting that white blood cell inflammation, which is pushing your cortisol button over and over. This becomes non-adaptive and not good for you. So just like I was saying, when you press your cortisol button over and over, this leads to a non-adaptive response, meaning you may not have cortisol to put out anymore, and you're not going to be able to take care of the stressor as well. You do this long enough, you wear out your cortisol capabilities. The end result of that, in particular, is adrenal fatigue, and that's a big deal. And that's actually a big deal with athletes. Is these athletes, whether they're weekend warriors or professional athletes, many of them are overtraining and don't train well. They're because for example, exercise is a stressor. You get a cortisol release when you exercise, and so if you don't have enough cortisol circulating, then you're not going to be able to get that cortisol bump. And so then people train extra hard because they say, well, I'm a little bit tired after working out, but I'll work out again tomorrow. And they do this over and over. Well, you can just imagine if they're at the same time eating foods they shouldn't be eating, they're taking away that, again, they're going to be creating a white blood cell inflammatory response. They're going to be pressing the cortisol button. Over time, they're going to do more harm than good. And so with athletes, it's an interesting connection, I think, to how well they can train and the foods they're eating. Another response, I was talking about the mitochondria. Mitochondria are a cellular workforce responsible for ATP production, basically, eventually taking everything you eat, fats, carbohydrates, proteins, and turning it through the cellular wheels to make ATP energy. And this is certainly impaired by an overstimulated immune system. So, again, white blood cell response over and over leads to an overstimulated immune system. So how do I think about that? If your mitochondria are not working efficiently, you're not going to be able to make ATP energy efficiently. In terms of athletes, this is a big deal because for them, they want to be making as much energy as possible. They want to run as fast as they can, jump as high as they possibly can. And if they're not able to, if they're at a detriment because if their mitochondria are not working well, then they are going to suffer as a result. Overall, the big endpoint is that they have less energy production. And this is what really happens with type 2 diabetes. Type 2 diabetics have many less working mitochondria. So, again, if the goal is to find the root cause of the problem, which we always try to do, I think you can turn to food, the way people eat, in regards to what food choices they're making, and eating foods in certain ways, which is contributing to this underproduction of ATP happening in the mitochondria. Going back to athletes, there's a study, I think it was done either last year or the year before. They looked at, I think it was in the Netherlands, they looked at men over the age of 50 who ran marathons, and it was kind of a retrospective study looking back. And they looked at men who ran marathons and compared some data about men who were over 50-year-olds who did not run marathons. And the results, although the marathon runners had lower blood pressure, lower cholesterol, they had a higher percentage of coronary artery disease and heart attacks. And to me, this is not so surprising because, again, exercise is a stressor, and if you're wearing out your cortisol because if you're overtraining, and I run marathons and I know that that's very hard on your body, and the tendency is to try to train too much, you're gonna wear out your cortisol. The way I link ALCAT with this is you're at a disadvantage if you're eating the wrong foods. I mean, a lot is made about, okay, we need to eat carbohydrates at a certain time to peak your carbohydrates, and protein at a certain time, and fats, and that's all well and good. But again, those are general recommendations. I think the neat thing about ALCAT is you can really individualize this. So if you have, whether it be well people, athletes, weekend warriors, or sick people, everyone benefits. Everyone benefits from figuring this out. So exercise is really good for you, right? We know that. But there's lots of examples of young, healthy people having heart attacks even while running. And I go back to this is because of too much inflammation. They, again, may be in good shape. Now, this excludes people who have structural heart disease. There's lots of examples of people being in good shape, not having any structural heart disease, who have atherosclerosis. And I think for these people, part of the problem is they didn't eat well and they didn't know. And so the ALCAT test is helpful here. And so again, we're measuring the inflammatory response from food, and the way I think about it, food is a common denominator. So I just want to run through some case examples. Patient SB is a 54-year-old male I saw. He's got a history of high blood pressure, high cholesterol. When I first saw him, he was taking a couple pharmaceuticals. He was taking lisinopril for his blood pressure. He was taking Lipitor for his cholesterol. He was tired. He had low energy. He wasn't feeling well. What did his ALCAT reveal? The big things for him, he had a moderate intolerance to gluten and casein and garlic. And that may seem trivial, but it actually turned out to be the key. He did a really good job in the first month of eliminating gluten foods, eliminating dairy. But he loved garlic, and he said, after the first month, I'm really not feeling that well. His blood pressure was okay. I said, well, and he said, but I have not eliminated garlic. I just love it too much. And I said, well, maybe try doing that and see where things play out. So he eliminated the garlic. After about 2 months, he lost about 8 pounds. He had an increase in energy. When he came back to see me again, he was feeling tremendous. After that, we got him off his prescription medicines. His blood pressure normalized. His cholesterol normalized. And to this day, he's doing really well. And he stays off the garlic. And so for him, the ALCAT test was a really powerful tool because it allowed us to see, okay, he's eating foods he shouldn't be eating, which is contributing to him not feeling well, which is then contributing to his high blood pressure, high cholesterol. Certainly part of, I think, the reason he had success is because he was able to feel better. And when he felt better, he had more energy, he was able to exercise more. And again, this helped his blood pressure and cholesterol as well. I saw another patient. He was a 55-year-old male. He had a history of psoriasis and heart disease. He came to see me. He had a 4 to 5 week history of joint pain. He'd like to run, and in the past 4 to 5 weeks, he had a lot of joint pain. His psoriasis was worsening in that time frame as well. So his big thing, when we tested him, his only red food, and red foods, when you do the ALCAT testing, you break it down by color codes. So red foods show the severe intolerance. Orange foods are moderate intolerance. Yellow food is mild. And then green foods is no reaction. Then there's 3 categories. The blue categories, candida, gluten/gliadin, and then casein and whey. The blue foods, as I just think about it, they tend to be more common and more severe when they occur. So for him, his red food, his most severe, was olives, including olive oil. And when I went and gave him the results, I thought, oh, he's going to laugh at me because olives. But he said, wow, I've been eating a ton of olives in the last 4 to 5 weeks. And so he stopped. He got off olive oil. He stopped eating olives. And practically 100% of his joint pain disappeared. His psoriasis improved. His energy levels improved. And it was really kind of remarkable. And there's no way he could have picked up on that unless he had done the ALCAT test. There's no way he could have tried an elimination diet and even thought of olives. So that was a really, really neat turnaround. Weight loss. I saw a female, initials TW. She's 26 years old. She was a newly diagnosed type 2 diabetic. She came to me, and she was diagnosed by another doctor having diabetes, and she came to me and said, well, what should we do? And I said, well, I could preach to you about, going on a diabetic diet and eating this food and that, but I think that you'd be better served by figuring out which foods you react to and which foods you don't. So we performed the ALCAT test. So she had several things. I mean, she was reacting to a lot of things. Her red foods, again, red is severe intolerance. Romaine lettuce, cane sugar, chicken, apples. Apples, by the way, is one of the most common reactions people have. Her orange foods were soybeans, tomatoes, cow's milk. Her blue, again, blue tend to be more common and more severe when they occur, was moderate reaction for gluten and gliadins. So she really took this seriously. She dove right into her 4-day rotation diet. So the great part about the ALCAT test results, not only do you get the color coding of where foods show up in terms of reaction. Again, red is severe intolerance, orange is moderate, yellow is mild, green is no reaction, and blue, they get their own category. But then they also formulate a 4-day rotation diet. And the way I explain this to patients, it's not just what you eat, it's how you eat it. And we tend to, we tend to eat the foods we like all the time. People like their turkey sandwich. They have a turkey sandwich every day for lunch. And I think the real key with ALCAT is getting people to move towards a rotational diet in which they're not eating the same foods all the time. And so, this is a really good tool for people because they can put it on the refrigerator, they can plan things out, they can take it with them when they go out to restaurants, and it's really, really valuable. So this patient, TW, dived into her 4-day rotation diet. 4 weeks later, she lost 6 pounds. Her blood sugar began stabilizing. After about 12 weeks, her cholesterol normalized. Her blood sugar was well controlled as long as she remained on her 4-day rotation diet. And it's really remarkable, and she really enjoyed it. She had a lot more energy and felt really good. So, I link the ALCAT test to inflammation and inflammation coming from food. Again, the other part that is a nice part to test is things like food additives and food colorings, environmental chemicals, molds, pharmacoactive agents. And I tell people that, when you look at the results, you will see these substances, if I'm going to categorize them, that show up in topical products, cosmetic products, household cleaning products. A very common result for people is fluoride. Most people react to fluoride, and I tell people to get off fluorinated toothpaste. And so you can learn a ton of information you can't learn any other way. So this inflammation is a drain on energy sources. It causes hormonal disturbances, mitochondrial inefficiencies, fatty acids insufficiencies, and the bottom line is that food is inflammatory. As I tell my patients, ideally every single person eats some sort of rotational diet, and it's very hard for people to figure this out on their own. And so the really great thing about ALCAT is they do the hard work for you, and they pinpoint everything, and it makes it very easy. And I think patients like that. And a real takeaway point for me when I started doing ALCAT is I started looking at patients who were sick. But now, you really can extend it to people who are healthy, looking to optimize their nutrition and just prevent. I really think ALCAT's one of these things that, will become standard in the conventional medical world. Give it 100 years or so when everyone else figures out that food really is inflammatory, and we need to figure out for everyone what we should and shouldn't be eating. So we really can reduce the inflammatory nature of food by reducing repeated exposures to it, and I think that is the key with the rotation diet. And again, that's really difficult to ascertain without measuring. The last thing I want to say about this, and relates to anyone, whether you're going to be testing people who are just curious, whether you're going to test people who have, diagnosed diseases like high blood pressure or diabetes, whether you're going to be testing any well person, is that food and eating should be joyous and fun. I had a patient who we did the ALCAT test a couple weeks ago, and he came in to see me the week later, and he was stressed out beyond belief because he couldn't figure out how he was going to fit everything in and do it all. And he was so stressed out. And I think at that point you need to remind people that, food is really supposed to be joyous, and life's supposed to be joyous, so anything that's stressful is going to create inflammation. So if the ALCAT results become tedious and they become stressful, then that patient needs to back off. Because it can be overwhelming. You get a ton of information that you haven't ever heard. When I give patients ALCAT results, they're just overwhelmed, and it's a really neat thing. But it can, for some people, when they take it to the utmost degree, can make it stressful for them, and that's a big problem. And so I have to remind people that this is supposed to be joyful, and eating is supposed to be joyful, like life's supposed to be joyful, and anything that gets in the way of that is going to be is stressful. So I just want to wrap up by saying that, ALCAT for me, really useful tool in helping, again, move forward, prevent things, whether it be someone who's diabetic, has heart disease, whether we're testing athletes, professional athletes, or whatnot, to help them reduce inflammation and have as much energy flow. And it's really true. I've seen tremendous results with ALCAT, and we've tested a ton of people nearly every day, and it's really the most awesome way to figure out what people should and shouldn't be eating. And it's been great for patients. So I'm going to end there and take questions. I'm going to leave my contact information up, and anyone can feel free to call me or email me with any questions after this. I'd love to help you out if I can.
Dr. Koniver, before I unmute everybody and we get the opportunity to ask some questions, I'm curious to know, what other tools do you use when you're evaluating patients for inflammation? I know there's a lot of options out there, not necessarily ALCAT, but when you're looking at patients, what else do you use?
Yeah, I think of inflammation. I touched upon cortisol, so we look at cortisol levels pretty frequently in trying to figure out how people are doing from an inflammatory standpoint. So that's a very common test is salivary cortisol levels. I think that's the best way to test it. Hormones, looking at individual hormones, whether it be sex hormones. For females, progesterone, estrogen, and testosterone. For men, primarily testosterone. So hormones can tell you a lot about inflammation. Traditional blood work, I think, is helpful to a degree. We look at organic acid testing. So we look at mitochondria, how the mitochondria are working. Those are the big ones that stick out to me.
Linda Yates has a question. What I'm going to do is unmute her real quick, and I'll let her ask the question herself. Give me one moment. All right, Linda, please feel free to ask your question now. Linda? All right, well, she wrote a question in the chat box. Oh, she's not on the phone. Hold on one moment. She wrote, if a patient has an IgE-mediated food allergy, will that food sensitivity show up with the ALCAT test?
And the answer is maybe, maybe not. I had a patient, again, it's total, if you're looking for apples, but you see oranges, it's not going to show up. So I had a patient who, she had called me over the weekend because she was having anaphylaxis. So she was at a restaurant, and she thought she'd eaten seafood when she shouldn't have, and eventually went to the emergency room, and we sent her to the allergist, and they skin tested her, IgE testing her for everything, and said that she didn't have an allergy at all. She had no IgE reaction, which didn't make sense. But then we did ALCAT testing on her, and several things showed up that she had said she ate. I think it goes both ways. But yes, certainly you can see similarities, but oftentimes you won't. And again, the way I explain to patients is you have a different measuring stick. You're looking at different things, so you have to expect different results. So IgE testing is just acute. ALCAT is white blood cells, and let me go back. IgE testing is just within the allergy pathway, immunoglobulin pathway. ALCAT is totally outside of that. It's just looking at white blood cell response.
Okay, I'd just like to add in there that if you have a known IgE, allergy, stick with that, and even if it, it can show up often that you can eat that on the ALCAT test. Follow that IgE allergy and do not eat that. We need to put that out there. But looks like Todd Ferguson has a question on ALCAT on the positives, false positives and false negatives. I'm going to unmute him one moment. One moment. All right, Todd, please feel free to go ask your question.
Yeah, I'm just wondering if you can comment on false positives. I've done a number of ALCAT tests, and a lot of things will show up, and I've heard that criticism before, but I've never really heard anyone comment on that. And if say 5 things show up in the red, 10 in the orange, and 30 in the yellow, which is a couple of patients I've had, how do you deal with that? I mean, that's a lot of food. Do you just focus on the red and the orange, or?
Yeah, I mean, I don't really, the way I think about it is, it correlates very well. So I see certainly when patients are, commonly I hear from patients when they look at their red and orange, they say, oh, I eat those things all the time. And to me that makes sense because you tend to react to the foods you're eating most frequently because they're not rotating much. And so I give people options. I say in terms of, okay, if it's going to be, do we go by just red, just orange, yellow? I try to get them to move towards the rotational diet. And so if they have, whether that's 1 red and 17 orange and 3 yellows, if they just stick with the rotation diet, they don't have to worry about the red and orange and yellow, whatever. They don't need to worry about it at all. They can just follow that. Now, for some people, that's overwhelming, and I tell them, well, for you, maybe you want to do it in stages. Maybe you just want to work on eliminating the reds. Maybe that's a good first step, and you get them to do that. And then maybe we'll work on the oranges. And once you're through that, maybe then you can work on starting to rotate your foods, or maybe you can work on the blue foods. I think there's lots of different ways to go about it. I mean, I try to keep them in check that the whole goal is to enjoy what they're eating, and that I think that they, obviously with anything, people feel once they get some positive results, they're going to buy into it more. And I think that happens pretty quickly with ALCAT, whether people are just choosing to focus on the red and orange, or whether they just dive in and do the 4-day rotation diet. So I hope that answers your question.
All right, Todd, thank you very much. The next question was from Jennifer Hoffines. I'm just going to unmute you real quick.
Hear me?
All right, Jennifer, if you want to ask your question.
Can you hear me?
Yeah.
Yep.
Okay. A patient says like they come in and they say they're lactose intolerant, and every time they have any type of dairy, it goes right through them. But they're green light, your green list for all type of dairy. What do you tell them?
Yeah, I mean, so maybe they are lactose intolerant, because again, ALCAT's not necessarily measuring that specifically. ALCAT's measuring your white blood cell response to either cow's milk, goat's milk, sheep's milk, whatever, or to casein and whey. So if they have an existing food that they know that they can't eat, I mean, I guess, how do you reconcile that? I reconcile that by, let's go back and look at what is ALCAT measuring. And we're not measuring lactose intolerance, and certainly there's going to be some things, lots of things that ALCAT doesn't measure that the patient already knows. They say, oh, I know when I have grapes, I get a rash, but my ALCAT says I can eat it. Well, okay, well then, probably you shouldn't, throw grapes into the mix if you know you get a rash, just because the test. I mean, I think there is some reconciliation, but for the vast majority of people, I think it tends to work out. I mean, I think it's people can see the results and they say, oh, wow, I knew that. certainly there's some people who say, mine is a green, but I know I can't eat it. Well, then I just have them cross it out on their 4-day rotation diet, and it's pretty straightforward. I just try to remind people, you have to go back to what is the test about, and some things it's not testing. It's not testing lactose intolerance, just like it's not testing IgE reactions to foods. So, you may have someone who says, I cannot get near peanuts or I will have anaphylaxis, yet, it's a green for me. Well, that's entirely possible because they're measuring two different things. So I just have people, in a practical sense, just if they know they can't eat a food, and it happens to be green or yellow, cross it out from that 4-day rotation diet, and then there's no issue. And then hopefully they can understand that exactly what the test is measuring.
Okay.
Thank you very much. Looks like the next question is from Lace Richer. I'm going to unmute you real quick. All right, Lace, if you have a question, please go ahead. Hello? Hello? All right, well, the question was, how much time do you wait to retest? Dr. Koniver?
Yeah, it's variable. Sometimes, I usually don't test until about 6 months. I think it's too soon to test at 3 months. So as soon as 6 months, but usually I've been retesting people at about a year, and that just seems to work into people's schedule and the way they're doing things. So I think it takes most people a little while to digest all this information and to warm up into it. And then once they get going, because if they do a good job, I had a patient just last month. She tested, her big thing was gluten, and then she wanted to know 6 months later, where am I? And she'd done a really good job, and when she retested, the gluten was, fine for her, and she was really happy about that. So some of it's patient-driven. If they say, hey, I really want to figure this out again, I want to stay on top of it, I'd say the earliest is 6 months. But most people, we plan on doing it about a year to see how they've been doing. And most people, if they've been doing a good job, they're going to have different results, and that's just as long as they know that. But most people are happy, because they've worked on things, and usually it works out pretty well.
All right, great. Thank you. I don't think there are any more questions in the chat box. If you have a question, I can unmute anybody and we can ask. Otherwise, I think we could probably adjourn. Does anybody else have any questions or anything else we can answer for you?
Unmuted.
I have a question.
Okay. Who is that? Just so I can make sure I can unmute everybody
Okay, this is Linda Lowy.
Okay, great. Thank you.
I was just wondering if you could explain a little bit about what the process is for getting a different result in 6 to 12 months.
So how do I explain that to people?
Yes.
Yeah, when they first get their results, they say, if they're good about following this, then they should, when you retest, the red food should go away, the orange food should go away, the blue should go away, because again, as long as you're eating a rotational type diet and not having the same foods all the time, then you begin to tolerate things better. If you do it in 6 months, yeah, that's only giving you time to eliminate those red foods, and you probably are going to have different foods. And then do they have to work on that? It depends. Again, what I have found practically is that the first results lead people to make changes in their way they eat, and those changes probably are going to stick with them better than subsequent results. So, for example, if they make a big change and they hop on the rotation diet and they're into that, a lot of foods that they gave up, that are red or orange, they probably won't bring back a lot of those because they've done away with them. And so it's not even going to be much of an issue. That's what I found with my patients is they're not really concerned about, the romaine lettuce, and they're not concerned about the chicken. They've given it up, and they say, if I have it every now and then, great. So if they retest and that, now it's something else, I have found practically that, yeah, people are more curious the second time, third time around, but it's that first time that makes a difference if they're going to buy into it. And when they buy into it, they do a really good job. And then the second time they test, it's more for curiosity, and I find that they don't necessarily, they've already given up certain foods. They've kind of acclimated to the 4-day rotation diet, and that's what they're going to stick with.
It looks like we've got 2 more questions. If you hold on one moment. Looks like Dr. Jay Whitlock had a question. I'm going to unmute you, Dr. Whitlock. Hold on one moment, and you can ask your question. Oh, I'm sorry. Yeah, you said you did not have the audio. I apologize. One sec. So the question was, how do you know what panel of testing to do since there are different levels? Dr. Koniver?
That's driven more by, I think, anything. Well, 2 things. I mean, one, what does the patient want to get? What do they feel they need to get? And then 2, the cost. So if the cost works out, I think doing everything is the best because you get the most information. If cost is an issue, then I try to get them to do as many foods as they could because I think that's the most important. And then I would add, next on that list after foods would be food additives, food colorings, probably environmental chemicals and molds. I think the least, practical part of the test is the pharmacoactive agents, the antibiotic stuff. That doesn't have as much practical value. But if the cost the cost is okay, then doing the platinum comprehensive I think is the best because you get the most information. But my hierarchy, how I look at it, foods are definitely number 1, so doing as many foods as you can. And I'd like to do all 200 foods because when you start eliminating foods, you want to have foods there for them to as an alternative. So doing as many foods as you can, and then after that I would look at I would do food additives, food colorings, then environmental chemicals, then probably molds, and then the pharmacoactive agents and the antibiotics and such.
It looks like Teresa Lassiter also had a question, so I'm going to unmute you. Teresa? Teresa, can you hear us? All right, well, her question was, do you start back from ground zero if you eat a red or orange food?
What I have found practically is that people will know. So that patient I mentioned who had olives, his number 1 red was an olive. Well, an orange for him was cane sugar. I just remember this, and was sugar. And he told me he had been off sugar for a couple weeks, and it was Halloween, and he tried a piece of Halloween candy. And he said he immediately just didn't feel right. It wasn't that he got so sick, but he just fell off. And that's what I hear from patients is that once they've eliminated things and they go back to it, either they're going to have some sort of reaction, they're going to know, and they're going to say, I don't want that anymore, or maybe they've eliminated it for long enough that they can tolerate it, because, again, the goal is not to be off it forever. So maybe they can tolerate it again. Or probably most commonly is people just forget about those foods. They're not interested anymore. They don't need to eat them, and they just stop eating them altogether. So I think that it's one of these answers that just depends, but that's my, that's how I've looked at it, is people either are going to react to that food, which is common. They say, oh, I got a reaction, or they're going to tolerate it. But most commonly is they just don't even try those foods again.
Great, thank you. Linda Yates also has a question. I don't think she has audio right now, but her question is, do you do anything else to address gut inflammation in patients who have many food sensitivities?
Yeah, I mean, the other end of the spectrum would be looking at what's in the environment. So, we do kind of comprehensive stool cultures and try to figure out what is going on. Do they have yeast overgrowth, bacterial overgrowth, parasite overgrowth? Do they have enough? Are they making enough digestive enzymes? What's the environment look like? And so part of it, certainly. I mean, people who have digestive issues I think of as two-pronged. One, they're eating the wrong foods, but two, the environment's the wrong environment, and so you have to take care of both. Certainly have to take care of the environmental issues with what's there. If there's any sort of overgrowth of, like I said, bacteria, parasites, then you need to address that. You need to eradicate those things, clean up the gut, as well as address the foods, or you're not going to be able to be successful.
Great, thank you. Looks like Maggie Thibodeau has a question as well. On retesting, will patients potentially have new intolerances, or are they more likely to have no intolerances?
Yeah, they're going to have new intolerances, and you say, well, how does that happen? That's probably the hardest part to explain to patients, is how do they develop new intolerances for even foods that they aren't eating. And I think part of that is an unknown. I mean, so that is hard to explain to patients as well. You know, I don't romaine lettuce. I don't eat romaine lettuce. I haven't eaten romaine lettuce for a long time, yet now it's a red. I think that's one of that gray area, which I honestly don't have a good answer for. And so, you know, the problem, it does create a problem then when you're retesting, because then you can keep going down this pathway of, oh, wow, I got to keep eliminating these different things. My experience has been that the first testing is what's most kind of gets people in line if they're going to buy into it, you know, if they're going to actually do it. And if they do it, then great. Then the repeat testing is more out of curiosity. It's not to then, therefore, change their diet completely again. Now, you may find differently in that people then just want to be proactive about their new 4-day rotation diet, and they do that every year. Great. I think from a practical point of view, people kind of get in line to get into some 4-day rotation diet. Many people don't want to retest, either from cost or they just say, hey, I'm feeling great. What's the need now? So you do want to interpret, you know, it's a lab result. You can't go solely by the lab result. You know, you have to go by how patients feel as well. So it is a good question. I don't have a great answer for, oh, well, how does that play out when they have a totally new red food that they haven't been eating that just pops up? You just need to make a decision on how you're going to handle that. And I think part of that is how are they feeling going into that test? You know, are they feeling great? If they're feeling great, you may not go by that so much. If they're feeling poorly, you may give that more credence.
Great, thank you. Dr. Heather has a great question here, and I'm going to unmute her real quick so she can ask it. All right, Dr. Heather, are you there? Oh, she might not be able to speak, but hold on one moment. I'm going to ask this question real quick. Okay, yep, she doesn't have a mic. Well, her question is, have you found any connection with anxiety/depression with food intolerances?
Yeah, definitely. I mean, certainly with anxiety, probably more than depression, it seems that there's a huge connection with the foods you're eating and how you feel. I have lots of patients who, you know, I think what jumps out at me is the gluten stuff. Gluten, there seems to be a connection with gluten and anxiety, and the more people are intolerant of gluten, the more anxious they are, and that just seems to how it plays out. And so there could be other foods, certainly, but there's definitely a strong connection between gluten and anxiety. And so I have lots of patients who have changed their diet, in particular gotten off gluten foods, and their anxiety's gone away almost completely. Depression, not as much. I mean, I know there's a link, again, with, you know, inflammation and messing up hormones. It's going to mess up neurotransmitters, so there's certainly a link. It doesn't stand out to me as being as strong a link. Anxiety, without a doubt, though, and what stands out the most about anxiety is the gluten stuff.
Excellent. Thank you very much. Is there anybody else who has any questions or any follow-up questions? Anything that we can help answer for you? Please type it into the chat box, or I'll unmute everybody right now.
Yeah, and I don't know if that's been asked or not. This is Claudia Jura. Rada, I'd like to know when you, once you've done the 6 months and done it pretty right on, should you stay away from the red items for the rest of your life? Can you have them once in a while?
Yeah, I mean, ideally you can reintroduce as long as you do it when you rotate them. Practically, though, a lot of people don't reintroduce them because they say, hey, I'm feeling so much better, why mess with a good thing? But, yeah, I mean, ideally, that 6 months is a time to kind of detox from the food, get it out of your system completely, let things settle down. And then if you bring it back, you have to bring it back in a rotation-type style. And the ALCAT results are very good about that, is that all the red and orange foods will be given specific days to bring them back into. So say apple is a red food. You'll know to tell the patient, okay, when you're ready to bring back apples, if you are, put it into day 2 or put it into day 3. And so they know specifically where to put it in, and it's a reminder that you can bring back foods, but you have to rotate them, or else they're going to cause problems down the road.
Okay, and one more quick question. In the milk product, the cows in the goat sheep milk in the green, do they all also rotate the days, or is it day, next sheep the next?
I didn't get that, Daniel. Can you rephrase that?
I had a hard time understanding it as well. If you could maybe type in that question. Was that Giantindra Shah, if I'm not mistaken? Was that who it was just speaking?
No, it's Claudia Ura.
Oh, okay. Hold on one moment. I'm gonna mute everybody just so we can get all the background noise out of there. Ooh. I'm not sure I'm seeing you in there.
Okay, I'm here. Can you hear me?
Yep, I can hear you fine.
Okay. Question. Let's say the cow's milk was in the orange category. Goat and sheep milk were in the green category. Do they still have to be rotated? Let's say you could have cow's milk one day, the next day you could have goat, the next day you could have sheep, and rotate it that way? Or would you have to stay away from all the milk products for 4 days? Are they in one category?
Yeah, well, it depends. If they, you have to look at their casein and whey, because their casein and whey are going to matter in terms of all dairy products across the board. So you can react individually to cow's milk, sheep's milk, goat's milk, but then you can also react separately to casein and whey. Even if a food, though, is a green, you're still going to want to rotate it, because again, you don't want to have it all the time. Now, practically speaking, you can reassure patients, hey, you're not reacting to this, but so it's probably okay every now and then, but ideally you rotate them. But it has to be practical for patients. If people they're not reacting to cow's milk and dairy's fine, and they have a little milk in their coffee, and that's what they like, and hey, that's what's going to help them do fine, then sure, have them go for it. Again, it's supposed to be a positive experience. So, I tell people don't get too, deranged by the details.
Right.
You want to follow it. It's a roadmap, and you work towards it, but you don't, if it becomes negative, again, you have to back off.
Right. But if there's still congestion or so, then back off and, yeah.
Yeah, exactly. So, again, orange they're going to eliminate. If it's a green, I still have them try to rotate it as best you can. Again, it's what the patient can do the best they can, because it has to be positive.
Right. Okay. Thank you.
Mm-hmm.
Great. Well, thank you for that question. Is there anybody else who has a question? It looks like Dr. Ford just arrived. Is there anything that we can answer for anybody else before we sort of part ways here? Anybody? Looks like we're good. Dr. Koniver, it looks like Dr. Don Ford just stopped in. If you could stick around for just a minute and see if you have any questions.
Okay.
All right, cool. Yeah, otherwise, I think we're all set. I want to thank everybody for coming out. And if you have any other questions, please feel free to ask them. Dr. Koniver's contact information is on the screen, or if you need to get in contact with us or Dr. Koniver, you can always email the office, info@alcat.com, or on the phone number, 954-426-2304. Any other questions here? No, I think that's it. All right. Well, I thank everybody for coming out. I appreciate your time. And again, please feel free to ask us if you have any questions. Have a good evening.
Thank you.
Any other
Dr. Ford,
questions?
can you hear us? No, I don't think he's there. All right. Well, I guess we'll contact him later. But Dr. Koniver, I want to thank you very much for doing this with us.
Yes, Dr. Koniver, this is Darren. Thank you so much. We certainly appreciate it.
Oh, you're welcome, Darren.
Great. And we'll be in touch with you shortly, okay?
Okay. Talk to you guys later.
Great.
Okay.
Thank you for everybody for coming out.